really worried. Mom is detected with cancer. Her doctor said she requires something called bone marrow transplant. But what is bone marrow transplant? Is it a surgery? Is it a big one? Will Mom be fine? I'm really scared.
Don't worry. You will be fine. How are you, Leela? Well, your mom did tell me that you love to make sketches. Wow, you are really a good artist. And I have an interesting video for my little artist friend. You could inherit an immense wealth or a supreme talent and proudly express it as, "It's in my blood." But do you know what's really there in your blood? Your blood is made up of 4 major components: plasma, red blood cells, white blood cells, and platelets. Out of these red blood cells, most white blood cells and platelets are produced in the bone marrow. So what is bone marrow? Bone marrow is the soft spongy area in the center of some of the larger bones of your body. It contains blood-forming immature cells known as hematopoietic stem cells or HSCs. And you must thank these HSCs as they make new blood cells for you throughout your lifespan. What is bone marrow transplant? But at times when certain chronic infections, diseases or cancers invade your body, the bone marrow cannot perform its function properly. In such cases, bone marrow transplant plays the savior. It is a procedure performed to replace damaged or destroyed bone marrow with healthy bone marrow stem cells. Let's understand what autologous transplant is. The term auto means self, so the process involves use of patient's own stem cells. Steps involved in the process. First, collection. Stem cells are directly collected from the patient's bone marrow with a needle, which is placed in the hip bone or iliac crest bone. Stem cells can also be collected from patient's blood and are called peripheral blood stem cells. Second, processing. These stem cells are further isolated and concentrated in the laboratory, which prepares them for the storage. Third, cryopreservation. Stem cells are then frozen at extremely low temperature and are preserved in protective solution, which keeps them alive until the scheduled date of the patient's transplant. Fourth, chemotherapy. After the stem cell collection, patient receives chemotherapy and sometimes radiotherapy for few days. It destroys unwanted cancer cells and suppresses immune system so that it can accept new stem cells. This is called conditioning treatment. Fifth, reinfusion. After this treatment, stem cells are defrozen and reintroduced into the patient's bloodstream through a vein. Now the stem cells make their way to the bone marrow, where they get re-established and start making new blood cells. Allogenic transplant process. Now let's have a look at allogenic transplant. The term allo means other. So here, stem cells are collected from a genetically matched donor, which are then transferred to the patient. Steps involved in the allogenic transplant process are similar to autologous transplant process: collection, processing, cryopreservation, chemotherapy, and infusion. Post-transplantation. After the transplantation, the patient is given immunosuppressant therapy and antibiotics which prevent infections and help maintain new cells. The marrow functions decreases by the second or the third day after the allogenic stem cell infusion. The patient is kept in a protected environment to reduce chances of infection. The patient also receives periodic transfusions of red cells and platelets until the marrow function is restored. In allogenic transplants, donor stem cells can sometimes cause a serious complication called graft versus host disease, or GVHD. It is an immune reaction where the donated cells mistaken the patient's body as foreign and attack it. The condition is usually managed with drugs including steroids, which further suppresses the new immune system and reduce the symptoms. These drugs also reduce the risk of donor stem cells being rejected by the patient's body. Umbilical cord blood is an alternative stem cell source used in allogenic cell transplantation. Like bone marrow and peripheral blood, it is a rich source of stem cells and is proven advantageous over other stem cell sources. Cord blood is a preferable option for patients with uncommon tissue types. Studies have found that graft versus host disease (GVHD) is less common and less severe after cord blood transplant. Let us now have a quick glance at the role of the donor. A donor who is a family member is called matched related donor or MRD. They are of two types. A. Matched siblings donor, who has similar genetic makeup. They are usually brothers and sisters who share the same parents as the patient. B. Syngenic. It means the donor is an identical twin of the patient. Syngenic transplants are the least complicated ones because there is no risk of rejection or a tumor in the marrow. Return of immune system functioning is also prompt. 2. If family members are not a match, a donor is found through donor registries in medical terms. Such donors are called matched unrelated donors or MUD. A matched related donor is always preferred over other donor sources for allogenic cell transplantation since it includes a quicker and less expensive evaluation and improved clinical outcomes post-transplant. Do you know how a patient and a donor are matched for the bone marrow transplant? For matching, human leukocyte antigen or HLA typing is used. HLA are proteins found on the most cells of your body. Your immune system uses these proteins as markers to recognize which cells belong to the body and which do not. So, for a successful transplant, a close match between a donor's and a patient's HLA markers is essential. But sometimes, doctors can't find a close HLA match. In such cases, haploidentical transplant can be performed. In haploidentical transplant, the donor matches exactly half of the patient's HLA. Parents are always a half match for their children, whereas siblings have a 50% chance of being a half match for each other. Post-transplant, state of the new cells formation is regularly monitored, so the patient needs to stay in the hospital for the entire duration of the transplant. For autologous transplant, patient stays for a month post-transplant. And for allogenic transplant, the time period extends up to 3 months. However, the patients might need to stay longer if any complications arise. Recovery time is about 3 months and may take up to a year for the full recovery. Family members should stay with the patient, but only one person is allowed during the transplant. This is all about the bone marrow transplant, a life-saving procedure.
Leela looks little relaxed as she understands what BMT is. Leela at home, making sketches when a phone rings. Her father answers the call. And one day, Leela's dad received a news that they have found a matched donor for her mom. Leela and her dad both have tears in their eyes and are happy. Leela's mother was in a hospital room and awake during the bone marrow transplantation process. Stem cells were infused into her body through an intravenous IV line. The procedure was like a blood transfusion. Central venous catheter. She underwent a central line placement. A thin, flexible plastic tube was inserted into a large vein in her chest to infuse medications, hematopoietic stem cells, as well as to withdraw blood samples. It avoided the need for multiple intravenous lines and needle pricks. Common side effects. Leela knew how important it was to follow hospital's stem cell transplantation treatment plan, as patients face an increased risk of infection for many months follow the transplant. In the first 2 weeks, the patient might develop mouth sores, gastrointestinal toxicity, along with hepatic and renal diseases. Later, for 3 months, there is a risk of GVHD, idiopathic pneumonia syndrome, and cytomegalovirus infection. Post that period, patients do run a risk of developing chronic GVHD. But Leela's mom could manage Such side effects due to Leela's strong support and Dr. Lalonde's proper medical advice. Leela's mom survived cancer. Myths about donation. Thousands of patients suffering from blood diseases need life-saving stem cells transplant. Out of them, only 30% patients find donors in the family, and rest rely on the bone marrow registries. Such registries are built in most large developed nations, but still, bone marrow donation is shadowed by myths. Neither it involves surgery, nor piece of bones are removed, and certainly donation is not bad for the donor's health. Rather, it is a life-changing opportunity, an opportunity to spread smiles. With right information and support regarding bone marrow transplantation, we can surely beat life-threatening diseases like cancer. An awareness initiative by Natco Pharma.